So, Roger, please welcome to the show.
Thank you, Garang.
So, Roger, for this episode, you interviewed a South Sudanese civil society leader, Jacob Aluong, if I'm getting his name right. And you've been focusing on the role of his organization and other civil society leaders in actually combating COVID-19 in South Sudan. And so really getting the sense and really zeroing in on what is going on the ground and what people are doing. So folks like him and what they are doing, some of the challenges that they are facing, how they are working very hard to overcome those, and how others can actually work hand in hand with them to support them, including even the government, to support these people who are doing things on the ground, and running it. But before we get into that, before you play that interview for our audience, I just have a few questions that I wanted to maybe you elaborate a little bit on them, you highlight some of the facts, and then after that you will play the interview. So like the first question that is in my mind is, what is the latest update on what is going on in South Sudan, and what are the figures, especially in terms of the infection, in terms of the recoveries, in terms of deaths? Just give us.
Well, the latest figures released by the Ministry of Health were on Monday, the 15th, and they confirmed 21 new cases of COVID-19 in South Sudan, bringing the total of confirmed cases to 1,776. And on recoveries, the statement from the ministry says there are so far 58 recoveries in total and 30 deaths. So those are the figures we have so far as of Monday.
Yeah. So it looks like, based on the figures that you've been able to assemble and gather and put together, it looks like, and you can correct me if I'm wrong, but it looks like the number of those who have recovered from the pandemic continue to remain low. Okay, so why is that? Is there an explanation, and especially in your research and conversation with folks on the ground, like the experts, the health experts, reliable sources from the government, and even other civil society organizations? Why is that? Can you speak to that a little bit?
Well, as you know, our show is still new, and we have been putting things together to get it running since we started a few days, and now almost 3 weeks ago. So I've not been able to reach out to anyone on this question you've asked. However, I read on Radio Mireya that the spokesperson of the Ministry of Health, Dr. Thoy Lui, said that in South Sudan, the recovery of patients is on the low side due to lack of follow-up of patients and individuals in self-isolation. So that's an official spokesperson of the ministry.
So that's basically like the latest that we've been able to get, which is really commendable. And I really thank you, Roger, for all the work that you are really doing on the ground and really coming to this, keeping our people updated, getting to the heart of what is going on and being able to provide accurate information as much as possible. That's the future we want to create. That's the essence of this show, the weekly review, making sense of the news. And so we'll continue to really dig further. And so let's, that's something you need to continue working on from here. We will wait to hear more news as you really get into the heart of what is going on as you do your research. So in the next show, we'll probably pick up from there. But for now, Can you play us for us the interview that you did with that civil society leader, Jacob Aluong?
Thank you. The interview is about 15 to 16 minutes long, and here it is.
Hello, this is the weekly review. With me is Jacob Aluong, the founder of Nonviolent Youth Initiative. Welcome to the show.
Rogers, and thank you for having me.
Yes, let's go straight to the question. Tell us a little bit about the Nonviolent Youth Initiative.
Nonviolent Youth Initiative is a pollination project that I started back in 2016 when violence erupted here in Juba. And yes, I was just thinking, what can I do to put my hand in, to help in this situation. So I founded it as not like a profit, non-profit making organization, but yes, I just wanted it to be a platform for me to air out and approach youth and other peace partners here in South Sudan. The main aim is to, to work with the young people, to teach them about peace and teach them about non-violent approaches to conflict. Here in South Sudan, we are growing, a good number of youth, that is like 70 or 65% of our population, but they are very violent. If you come to the street of Juba here, you find them fighting each other, especially on weekends. And I thought, this platform will give me upper hand to approach them and tell them more about peace. So I found it until last year is when I registered it officially as a non-profit making organization, but it's it's operating at the very minimal level. So yes, that is what I do. I do a few stuff, to reach out.
And tell our audience what is the Nonviolent Youth Initiative doing on this fight against COVID-19 in South Sudan?
Nonviolent Youth Initiative is in the front line. We are disseminating information. We are also partnering with other youth organizations here in South Sudan. So we disseminate information about COVID-19, how deadly it is, and preventive measures. We also advocate just mainly online, and I also talk physically to policymakers, to prioritize the fight against COVID-19. And I have also approached different youth. Some people in Uganda in Bidibidi refugees camp, I have already approached them, and they are doing the same thing. They are also raising money to feed the poor people. And back here in South Sudan, here in Juba, and also in Jonglei State, I have other two colleagues who are running around trying to raise money to feed the poor people. I think you can remember when our country was partially locked down. We were locked down without food, we were locked down without water.
We'll get to the lockdown issue a little bit. About what you do at the moment, what have you done? How small or how big it is? We would like to know also, so that others could learn from the experience and on how also to improve and respond to challenges maybe that the Nonviolent Youth Initiative is facing on the fight against COVID-19. So let's start with specifics. What exactly, practically, that you have done, and what experience could we learn from it?
Mainly, it is awareness and sensitization of the public. That is what we are doing. We are, like I said, we are partnering with other NGOs who are taking a lead in the fight against COVID-19. So we have banners, we distribute banners. And there is also this youth movement, they call it South Sudan Youth Fight Against COVID-19. I'm part of it also. And I am part of the leadership there. So we advise, and on my platform, I also take the same information and also send it to my colleagues whom we are working at Nonviolent Youth Initiative. So mainly we don't have some funding. So, but I said, we cannot sit down. We have that upper hand. We can still disseminate this vital information through social media and through, maybe youth gathering, and then share all those stuff. So mainly that is what we have been doing practically. But yes, we are not big, but we are small and effective. That's what we have been doing, partnering, dissemination of the information and sensitization, and then maybe provision of cleaning items to people, to some few households here in Juba. That's what we are doing right now.
In what you've been doing, what experience have you learned and challenges, and how do you think others, or who do you think could also help and push you forward in this struggle against COVID-19 in South Sudan?
I am not a scientist or a medical person, but yeah, I've seen practical challenges in the field. One is the rigidity of our population. They don't look at COVID-19 as a deadly disease, so they just say that, they keep saying, well, they play it down a lot. They say, it is a disease for the white people. It is not a disease for African. And regardless of the awareness, regardless of the information we have online and even on air in some media houses, people are still rigid. They don't welcome people. They play everything down. They just think it is normal, and it has been here for months. It didn't just came recently this year. So that is the main challenge. Imagine going out and you want to help someone, and someone behave as if he or she knows COVID-19. And we go in deep and explain how it has stopped the world, from moving around. And of course, the level of education in our country also here is a big challenge. Many people do not have access to information, or information that they can find on their own. They depend on people. Say if a chief come today and maybe talk to his own people and play COVID-19 down, that population will go with the information of the chief because they cannot verify it on their own. So it's a big challenge. The literacy rate here in South Sudan is very, very minimal, and it's affecting us. Another challenge is, is when you show up and you try to talk to people about having them stay in the house. And you tell someone to stay in the house, they even laugh at you first when you come with energy trying to help them, but they say, hey, you are telling me to remain indoor and do what? I don't have food, and I don't have saving anyway. So how can I really be in my house? So these are the few challenges we face. And then people think also it is a government initiative, like a propaganda for them to make money from foreign governments. So we face all these challenges in the field when we go. And I think these are the few challenges that I can share with you. And then lack of funding to do massive outreach. We are just struggling on our own. The mobility, we are restricted here in Juba. Like for me, I'm restricted here in Juba. I cannot go beyond Juba because of the insecurity itself and the restriction that was imposed on us. So these are the main challenges. And then the continuous displacement of the people. When you talk to this population today, tomorrow you find them, maybe they are displaced somewhere and they are mingling. Like I've seen more families coming from the rural areas, and they are now crammed in churches or in schools trying to protect each other. So it's a big setback, when you want to sensitize and that you see other external forces trying to disrupt the good work that we are trying to do.
Talking about food, have you been able to do something about that?
Yes, there's no food. Our population, we have been at war. We have not saved any money. The economy is completely to its knees. No one is making money. But yeah, when you hear lockdown being imposed on the population, I look at that as outrageous. There is no food that has been distributed by partners or even by the government. and you hear government saying you must remain in your houses. So there is no food. People, would just violate the lockdown or the curfew to go and find some food outside. So food is the major issue. Is a major issue that is really, really facing the implementation or the fight against COVID-19. You cannot tell an hungry person to be obedient when he or she has nothing in the store. So this is a critical point that I almost forgot. But yes, food is food just after food. When you give them soap to clean their hands, they even laugh at you. They say, we don't need soap. We need food. We are hungry. We are not dirty. So you hear sometime when I go out with these stories, and the issue of food is a major issue.
Has your organization been able to provide any kind of little food to families?
Yes. I, since I saw that gap, I decided to start fundraising. Like I said earlier, we are very small. We don't have any funding in place, and COVID-19 came when we don't have funding. But I said we just need to take it upon ourselves and maybe raise some money online. So I have been raising money online just for from house to house. I would show up in someone's house and explain my intention to them. That I'm here to help them, and if you are okay with it, then I will go and raise some money, and fundraising will be online. So I seek their permission, and that is what I've been doing. That is the only window I have been providing food to few families around Juba and outside Juba as well.
What families, what platform do you use for the fundraising, the online platform, and how many families have you been able to support, and at how much?
Yes, I've been using a platform called Donacy. Donacy is a US-based organization. It's a US-based online fundraising organization. So I had a privilege to meet the CEO in Washington, D.C. last year, and I became a storyteller, and I have my profile there on that organization. So every time I get a need, someone in need, I would shoot a video and then upload it, and it is funded. It's like a crowdfunding platform. Yes, I have helped about 42 households right now in Juba, and we have also provided food for some families in Bor, in Jonglei Estate, about 11 of them. And I have more projects right now online which are yet to be funded. So when they are funded, I think I will exceed. I will reach about 50 households, and I mainly raise about like $200 per household. So it's like a few thousands of dollars. Maybe I think it's about to be $5,000 since I started. To reach out to these poor families who are starving indoors. I don't only raise money for food. I raise money for food, and then for cleaning items, and then for sensitization. That gives me some time to sit down with them when I give them food, and then pass my information to them. So yes, roughly about $4,800 there have been raised so far, and about 45 families have been served so far to boost the immune system. I heard that COVID-19 kills really fast when you have pre-existing conditions such as malnutrition or pre-existing diseases. So yeah, my intention is to boost the immune system for the families and for them to be ready to fight COVID-19.
Finally, what is your message to the government on this fight against COVID-19?
My message to the government is not to copy and paste what has been done outside South Sudan. We are a different country. We don't have running water. We don't have electricity. We have poor population, and we have conflict going on. So we need to stop these issues of copy and paste. We need to look and define our own situation, and then respond accordingly. They need to I would also advise government to provide food. They promised door-to-door food distribution when they first announced lockdown, but nothing has been done so far. I heard they were going to partner with WFP, but nothing has been done so far. And that is why people like me and my organization are stepping in to fill that gap. So I really encourage them to take the fight against COVID-19 seriously by providing food and maybe do massive testing, not only in Juba, but also in the states. It has finally reached the states, and government need to move there. To make the fight more comprehensive. So that is my advice to the government right now.
Thank you, Jacob Walong, the founder of Nonviolent Youth Initiative, for your time. We will later pick it up from there in case there's anything that comes up on this fight against COVID-19. Once again, thank you.
Thank you so much, Mr. Rogers, for hosting me, and I thank South Network again for giving me this opportunity, and I hope to see you in future.
That was the interview. As a matter of fact, I was to include some other civil society members in that interview, but some challenges first at their side, and then later on mine, on my end, made it impossible for that to happen. I will follow up with them and other relevant sources soon in our episodes ahead. And Garang, now back to you in the studio.
With this, we have now come to the end of part 1 of the weekly review, making sense of the news. In part 1, we focus exclusively on the COVID-19 in South Sudan and what the civil society leaders are doing to actually address this critical phenomenon. So follow us on YouTube, follow us on Facebook, visit our page also on sawasawanetwork.org. Also visit us on Twitter. With that, let me say bye for now. Stay tuned to our part 1 and part 2. Thank you so much. God bless you.